Hi guys, it's Dr. McPherson. I'm at home today and I want to discuss dental disease with you. The most common anesthetic procedure that we do at Tuscarora Oaks Animal Hospital would be dental cleanings by far. We do them every week on several animals, dogs and cats. And unfortunately, in a lot of those cases, we have to end up extracting teeth, meaning we have to take teeth out that are loose or diseased or causing pain. So I wanted to talk to you guys about a couple of ways to prevent that from happening so that we don't get to that point. I prefer to do what's called a dental prophylaxis, just meaning we're cleaning relatively healthy teeth and just trying to keep them healthy. So similar to when you go to the dentist every 6 months or so, you're just trying to stay on top of things with your dental care. So let me just talk about dental disease in general. No matter what, if it's dog, cat, human, we basically get tartar just from bacteria and food and saliva just adhering to our teeth. And so over time, as it adheres to our teeth, we develop tartar. And so that's the actual visible layer, that you can see on your pet's teeth in a lot of cases. Sometimes dogs or cats may show discomfort, when dental disease gets to a certain point. But in a lot of cases, they may still be eating, drinking fine, and you may think everything's okay, but there can be significant problems going on in the mouth. Okay, so when that bacteria starts to adhere and then it gets underneath the gum line, that leads to gingivitis, that's inflammation of the gums. And then that leads to bone decay and then, or bone loss and then tooth decay. And then we have to end up taking these teeth out when you get tooth root abscesses. It's just infection underneath the gum line that causes loose teeth. So I'm going to go over a couple of things that you can do at home to prevent this from happening or at least help it. There are several things that you can do, either alone or in combination. One thing would be feeding a diet that helps with dental disease or prevent dental disease. So I have my dogs on this. This is my old bag that we just finished. So this is Hill's Healthy Advantage, and this is, if you can see down here, this is the oral care line. And so basically the way that diet works is that the kibble is really big, so that when my dog's tooth goes into the kibble, it helps to remove the tartar or any film that has built up on her teeth. And you'll see here in a minute. I'll do a quick little demonstration of how to brush teeth in a second. Another option would be to use dental chews. We carry Oravet at our clinic, which again, the purpose is that when the dog bites into this little chew, it helps to remove any layers of tartar that's starting to build up, and that helps to prevent any further dental disease from happening. So, and I just happen to I do have some Purina. This is another, dental chew that is pretty popular as well. There's several out there. And then also toys. There's toys, chew toys that you can use. You have to be careful with those because sometimes the toys can be very hard, and it can actually lead to more damage. If I have a dog that's chewing really, really hard, let's say on a hard bone, it can cause what's called a slab fracture, primarily on what we call the carnasial tooth, and a little piece of that tooth fractures off, and that can end up causing problems and bacteria to go up into the pulp of the tooth. So those are a couple of things that you can try, but the biggest thing is going to be brushing, okay? So just like you and me, brushing is going to be our mainstay of keeping that layer of gunk, off of your teeth. And it's the same for our dogs. I recommend brushing your pet's teeth at least 2 to 3 times a week if you can. I mean, every day's better, but life happens. I know it's hard sometimes to keep up with that, but 2 to 3 times a week can really make a significant difference. So when you are brushing your dog's teeth, you're just trying to do a gentle, massage of the gum line with either just a toothbrush, or you can get like the little doggy or baby toothbrushes that you put on your finger to get back into the deep pockets, especially with smaller dogs. Sometimes that's a little bit easier to do. So a gentle massage of the gum line, and then just brushing, again, just gently brushing the teeth as well. You're going to stick to the outside surfaces, because unless you have a really good pet, you're not going to be able to do the occlusal surfaces or the inner surfaces of the teeth. So let the food do that and just focus on the outside surfaces. And so you're basically just going to use a doggy tooth paste. It needs to be fluoride free and non-foaming, because our dogs can't spit their toothpaste out. We don't want them swallowing fluoride. And then just the same. Come here, Jessie. Come here. Come here. This is Jessie. So I'm just going to kind of briefly show you. I'm basically just gently, you know, up here, just with the gums. I want to get back here to the back teeth, because those are the ones we miss a lot. And then we're going to gently do the actual tooth as well. So you would just do this on all the different, you know, surfaces. It might take, you know, 2 people. Jessie's pretty good about it. Especially with the different types of doggy toothpaste, you can get them flavored, like a chicken flavor. So a lot of dogs just like it. I got a little dental treat for her, so you have that treat? There you go. So that's an easy way just to keep up with dental health, keep your dog's teeth as healthy as possible. Your homework is to go look at your dog's teeth. Look especially back in that back crevice. If you see any layer, that means that you may need to, you know, step up your dental game, okay? If you have any questions, you can always bring your pet in. We can do an exam to see if we think that a dental cleaning is needed. And we also have treats and oral chews, like I said before, that can help out with that as well. All right, you guys, you have a good one. Bye-bye.